Across the Caribbean, another storm is coming. But there's no name for this one. No warning system. No shelter plan. It doesn't rip through roofs. It breaks down families. It stretches hospitals. And it leaves elders behind. The Caribbean is graying faster than we realize. By 2050, over 1 in 4 people in this region will be age 60 or older. In countries like Barbados and St. Lucia, that number will be even higher. But here's the thing. We aren't ready. Not our health systems. Not our pension plans. Not our communities. Not even our mindset. This isn't just about growing old. It's about what happens to all of us when we ignore the generation that came before. The silver shift has begun. Across the English-speaking Caribbean, from Antigua and Barbuda to Jamaica, from the Bahamas to Trinidad and Tobago, the numbers are staggering. In 2000, only 10% of the population was age 60 and over. By 2015, it was 14%. By 2050, that number could climb to 25%. In Barbados, it could reach 31%. In St. Lucia, over 32%. This is happening faster than it did in Europe or North America, and with far fewer resources. Jamaica, which we have already explored in depth, is part of this trend. But this is a regional emergency, affecting all 20 full and associate CARICOM member states. And it's not just about more older people, it's about fewer younger ones. Fertility rates are dropping below replacement levels. Life expectancy is rising, and the base of our population pyramid is shrinking. The result? A top-heavy population, where elders outnumber the children. The hidden health crisis. But living longer doesn't mean living well. What is the leading cause of illness and death among older adults in the Caribbean? Non-communicable diseases, hypertension, diabetes, heart disease, cancer, stroke, and dementia. Up to 71% of Caribbean seniors have at least one chronic illness, and many suffer from multiple. But our healthcare systems weren't built for this. Most still focus on emergency care, not long-term support. In rural areas, clinics are few, doctors are scarce, and many older adults simply can't afford medication, tests, or transport. Add to that a massive brain drain, our best nurses and doctors migrating for better pay, and you have a ticking time bomb. The economic burden we're not ready for. Aging doesn't just impact health, it hits the economy hard. As more people retire, the old age dependency ratio goes up. That means fewer workers supporting more pensioners. In 10 Caribbean countries, the working age population is already declining. In others, it's flatlining. But pensions, most systems are built for a time when people didn't live so long. In places like Guyana, St. Vincent, and Belize, the pension coverage is patchy. Many older adults worked in informal jobs and never contributed to national schemes. Others contributed for decades, but now receive payments too small to survive on. And while some try to keep working, ageism, health issues, and shrinking job markets shut them out. We are entering a future where more and more Caribbean elders will be old, sick, and broke. The forgotten generation. And then comes the silence. Many seniors are left to live alone, isolated, invisible. Loneliness is real and painful. It leads to depression. It worsens physical illness. It shortens lives. And then there's elder abuse, often hidden, often committed by family members. Physical, emotional, financial, neglect. Yet most countries in the region have no dedicated law protecting older persons. Add to that, inaccessible homes and public buildings, no transport to clinics or shops, disaster preparedness plans that forget the elderly entirely. We are building societies that are simply not safe for older people. We've spent decades preparing for hurricanes, but not for our own aging. And this storm is already here. Why it's worse for small island states. Now imagine dealing with all this, but with limited money, high debt, and extreme weather. That's the small island developing state challenge. Many Caribbean nations rely heavily on tourism or agriculture. One bad hurricane, and national budgets collapse. Recovery takes years. Meanwhile, rising sea levels threaten coastal homes. Climate disasters hit seniors hardest, those who can't evacuate quickly, who need medications, and who rely on caregivers. And while young people migrate for better jobs abroad, the elderly are left behind, alone, unsupported, and out of sight. What's being done, and where we're falling short? To their credit, governments aren't ignoring the issue. Many have drafted national aging policies: Jamaica, Barbados, Trinidad and Tobago, and others. Some have non-contributory pensions to help the most vulnerable. Others run medication subsidy programs. A few have public housing options for the elderly. But here's the problem. These programs are often underfunded. Implementation is slow or fragmented, and services rarely reach rural areas. Worse still, formal long-term care systems, home care, day programs, trained caregivers are almost non-existent. Instead, we rely on families, especially women, granddaughters, daughters, sisters, unpaid, untrained, and overworked. But families are shrinking, and women can't carry this alone anymore. The role of CARICOM, from policy to action. This isn't just a national problem, it's a Caribbean problem, and that's where CARICOM must step up. With 20 full and associate members, CARICOM is uniquely positioned to develop regional guidelines on aging care, accessibility, and elder rights, set targets for long-term care services, pension reform, and elder legislation, support data collection and research to guide action, facilitate training and best practice exchange across member states, elevate aging as a development priority, on par with climate, youth, and crime. Because without coordinated regional action, we're just patching holes on a sinking ship. And time is running out. A better future is still possible. We don't have to see aging as a burden. Older adults bring wisdom, stability, and experience. They can mentor, volunteer, and guide younger generations. Many are still active, productive, and eager to contribute. We just need to see them, support them, respect them. We can reform pensions to be fair and sustainable, build accessible housing and transportation, integrate geriatric care into our health systems, protect seniors through dedicated laws, and most importantly, listen to them. With the support of regional bodies, international partners like PAHO, and community action, we can build a region where growing old is not a sentence, but a celebration. Here are 4 bonus facts. 1. By 2040, over 2.5 million Caribbean people will be 65 or older. 2. St. Lucia will soon have one of the oldest populations in the Western Hemisphere. 3. The Caribbean is aging faster than North America, but with far fewer safety nets. 4. Only a handful of countries have specific legislation to protect older persons. The Caribbean has endured storms, slavery, and struggle, but this challenge is different. It's not loud, it's not sudden, it's slow, quiet, easy to ignore. But make no mistake, the challenge is here, and how we treat our elders now is how we'll all be treated tomorrow. Let's build a Caribbean where aging is safe, dignified, and full of life. Let's not wait. Let's act together. If this video moved you, don't just click away. Subscribe, share, and speak up. Because how we care for our elders today is how we'll be cared for tomorrow. Let's change the future, one voice at a time.